This presentation highlights the Disease Containment Implementation Branch in the Infectious Disease Emergency Response Plan, or IDER plan, which is part of the IDER toolkit. During this presentation, we'll explain how the Disease Containment Implementation Branch is organized within the IDER plan, and we'll also identify the major functions of the Disease Containment Implementation Branch. The Disease Containment Implementation Branch is shown here, highlighted in the organizational chart. In the IDER plan, the Disease Containment Implementation Branch is part of the Operations section. The Disease Containment Implementation Branch is divided into 4 groups: the Community Mitigation Group, the Mass Prophylaxis Group, the Restriction, Exclusion, and Clearance Group, and the Isolation and Quarantine Group. Remember that each of these boxes shown in the organizational chart represents a function that might need to occur during an infectious disease emergency. Which boxes and functions are ultimately activated will depend upon the size of the emergency and the type of disease. The branch director will determine what functions to activate based on the needs of the response. The purpose of the Disease Containment Implementation Branch is to determine effective containment strategies and then to recommend and/or implement those containment strategies. Disease containment strategies recommended by this branch may include things like community mitigation strategies, the distribution of mass prophylaxis, isolation and quarantine measures, or restriction, exclusion, and clearance measures. The purpose of the Community Mitigation Group is to implement strategies to reduce the spread of disease in community settings. Some of these strategies might include things like social distancing, school dismissals and modifications, the postponement or cancellation of public events, and modifications to workplace settings. It's possible that during an infectious disease emergency, you may need to quickly provide vaccines or medications to large numbers of people. The purpose of the Mass Prophylaxis Group is to provide mass dispensing of vaccines and/or medications during the infectious disease emergency response. There are several ways to distribute mass prophylaxis during an emergency. One of the ways is to use point of dispensing, or POD sites. These are public sites located in a central location that can be used to quickly distribute vaccines or medications to large numbers of people. An alternate way is through the use of push dispensing sites. These are sometimes called closed pods. Closed pods use large businesses, community organizations, or other large facilities to distribute prophylaxis to its members. Because the use of pods and closed pods is very logistically challenging and staff-intensive, the IDER plan takes this into account. You may want to activate the pod staff training team, which will assign and train pod staff. There's also a function within the IDER plan that accounts for the management of multiple pods. The purpose of the Restriction, Exclusion, and Clearance Group is to prevent the secondary spread of an infectious disease by limiting the contacts that infected workers have with their clients. The Restriction, Exclusion, and Clearance Group focuses on people who work in special settings or occupations. Special settings or occupations might include people who work with children, the elderly, or disabled, people who work in jails or shelters, healthcare workers, or people who handle food. Finally, the Isolation and Quarantine Group works to prevent the secondary spread of an infectious disease by decreasing contacts between the infected and the uninfected. They do this by implementing isolation and quarantine measures. The Isolation and Quarantine Group will oversee the development and distribution of isolation and quarantine documents. They'll also coordinate closely and communicate with law enforcement if necessary. More detailed information about the Disease Containment Implementation Branch is available on our website in the Infectious Disease Emergency Response Toolkit. There you can download detailed templates that talk more about the purpose, the objectives, and implementation guidance for this branch. That concludes this presentation. This was just one component of the IDER toolkit. For more information about the IDER toolkit, please visit our website at www.sfbayapc.org.